All right, getting into the last section of this class, or the last lecture series of this class, which is pretty exciting and some of the good stuff here. But let's talk about burns. We mostly think of burns when we think of heat. In fact, most people think of sunburns as a heat burn. Um, but sunburns are actually considered radiation burns. The other causes for burns are going to be chemical reactions or electricity, which in the backcountry can also be caused by lightning, which we'll talk about here in a few. We'll talk about here in a few videos. So the severity of a burn has to do with depth. So superficial versus partial thickness versus full thickness. So this has to do with how many layers of the skin are impacted by the burn. Also, the category of burn has to do with what percentage of the body it covers. And so a lot of this is going to tell us or tell doctors what the treatment is, the likelihood for infection, things like that. So superficial burns are going to be the most outer layer. So that typical red burn that you'll see, sunburn, maybe got too close to fire or some sort of heat source, but it's not anything that we haven't seen before. In fact, most people have had superficial burns in the past. But when we start getting into some of the issues is when we get into these deeper burns. So your partial thickness. So this is red with swollen skin. And this is where we start to see blisters or some sort of fluid buildup. So this can be caused, again, by any of those sources that we just talked about. But what's important to notice is when it starts to get deeper like this is when we run into issues and a higher risk for infection. If one of these blisters is to rupture, now it becomes an open wound on the surface and we have to treat that. Another cause of this could be in the form of a blister, which you would have on the back of your heel or on your toe or somewhere where something is rubbing. Full thickness burn is when we start to get into those deeper parts of the skin. So we've now officially hit through every layer of skin, and we're at the connective tissue or the muscle tissue that is underneath our epidermis or our skin layer. So you'll notice the severity of this picture versus some of those previous pictures. Typically, this is painless skin because we have burned through the nerves that are there, and we start to have pale skin and from scalding or charred skin, and this could be the injury of a fire. So when checking a person to check the extent of the burn, so that way we can start making decisions on whether or not to evac the person. So we're going to look at the total body surface, okay? And so a person's palmar, the inner surface of the palm and the fingers, is 1% of total body surface, okay? So we can start adding up how big the burn is based on the size of their hand. So if there is more than 1% of the body is burned, it's considered a serious injury. So if there's a burn that is larger than that person's palm of their hand and fingers, then it's considered a severe injury, serious burn, which means we are going to evac, okay? So also note that if you suspect any sort of possible airway complications, maybe someone inhaled smoke or some sort of chemical that burned them from the inside, that will be a quick evac. And any sort of major electricity burns like a lightning would be that may have affected the heart or any sort of respiratory system, then we're always going to want to evac that person. So how do we give care if someone has a burn? So you're going to remove the person obviously from the source of the burn or danger before giving them care. You're going to stop the burning process quickly, 30 seconds if possible. So you're going to remove them from the heat source, smolder the flame, and move forward. If it's electricity, turn off the electricity first. If it's dry chemicals, brush that chemical off. So for example, in the front country, this might be something like dry chlorine, where you would just brush that off of the skin, and you wouldn't want to add water to that because that would actually create the chemical change to take place. You're always going to want to manage someone's ABCDEs to protect the person from shock or hypothermia, which we'll get into both of those here in a later series or in a later lecture. You're going to want to cool the burn with water for at least 20 minutes, okay? You're going to want to leave the burn blisters intact. So what I talked about in the previous slide is that if that blister is to rupture or burst, now we have an open wound that we have to keep clean. Even though the blister might be uncomfortable, if we have that there, it's still closed, right? So less likely chance for infection. And when we're talking about the back country, it's challenging to keep things clean, okay? You're going to want to move any jewelry or anything like that, just like we would with splinting, right? We don't want any sort of impact, swelling, irritation. The skin needs to go through its healing process. You're going to dress the burn with a thin layer of wound gel if you have it, okay? If you don't have it, then leave it alone, or put a dry dressing on the burn. You're going to cover the burn with gauze pad, and then you're not going to pack the wound, and you're not going to use ice because we have damage to that epidermis, that skin, okay? Elevate that burn space, so if it's on the arm or hand or foot, we want to elevate to try and avoid any sort of swelling. And make sure that the burn area, make sure to gently and regularly move that burned area so we can keep that blood flow. Make sure that you're keeping that person hydrated and monitoring the burn to make sure that there's not any more issues that you should be treating. So when do we evac? So burns are a rapid evac if the person has any sort of trouble breathing. If it is a partial or full thickness burn, so if you see blisters or you see burns that go all the way down to that connective tissue, or if the burn covers 10% or more of the person's total body, right? So 10 or more palms and fingers. A partial or full thickness burn that is covering an entire hand, an entire foot, or an entire body part is going to be a rapid evac. If there is any sort of serious burns to someone's head, face, neck, hands, feet, or genitals, quick evac. Full thickness burns that covers more than 5%, so the most severe burn for more than 5%, quick evac. Burns caused by any sort of chemical or explosion or electricity. There could be something happening interior that we can't see, and we don't want to wait until there's a problem before taking people to get help or evacing them. And any partial or full thickness burn to a child or an elderly person. So a child being age 5 and a elderly person being 60 or older.